Mr. Shrestha. How are you feeling today?
I'm good. How about you?
Good. My name is Mousami Shrestha. I'm going to be your student nurse today. So, can you tell me your full name and date of birth?
My name is Suman Shrestha, and my date of birth is March 3rd, 1993.
All right. So, I'm going to perform head to toe assessment just to get better determination of your health. So, is that fine for you?
Yeah, sure.
All right. So, do you want to use restroom before I started?
I just used it.
Okay. So then I'm gonna wash my hands, hand hygiene. Then I'm gonna elevate a bed a little bit up in my working height. Then I'm gonna provide privacy. Close the door. I already closed it. And then I'm gonna assemble my equipments. And now I'm gonna take his vital sign. So temperature, pulse, respiration, uh, blood pressure, oxygen saturation, height and weight. And I'm gonna ask him for pain. Are you feeling any pain?
No.
You're good.
I'm good.
All right. So he acknowledged me really well when I entered the room. So I'm gonna start from head. Okay. So I'm gonna check for hair distribution, any lice, any dandruff. It's all good. And let me check your pupil, okay?
Okay.
Okay, so I'm gonna look pupil for pupil are equal, reactive to light, round, and accommodation. So just look this one,
Okay.
where it goes. Here, there. Alrighty. And now I'm gonna check your ears.
Okay.
Up and out. So I'm gonna check for any abnormal discharge. Good. Then I'm gonna check for any nasal deviated or any abnormal discharge from nose. It's all good. Can you open your mouth wide? And can you take your tongue out a little bit? Okay. Alright, now I'm gonna check your any lymph nodes for any swelling. So good. And I'm gonna check carotid pulse at the same time, one side at a time. Alright, now I'm gonna go ahead and listen your lung sound. Can you take a deep breath in and deep breath out? Alright, and here's a resonant sound. And if you can sit straight, then I'm gonna listen his posterior lung sound too. Can you take a deep breath in and deep breath out? Alright, thank you. And you can go back again. And after the heart sound, after the lung sound, I'm gonna listen his heart sound, loud up, and then I'm going to listen aortic first. pulmonic, then herbs, then tricuspid, and then mitral and apical, that is in fifth intercostal, mid clavicular line. And I'm gonna listen his apical pulse for full 1 minute. Alright, it's 74 beats per minute, and that's normal.
Okay.
Now can you lie a little bit down so I can check your abdomen?
Sure.
And can I expose it a little bit?
Yep.
Thank you. Alright, so first I'm going to inspect, is there any lesions, any bruises, any abnormal marks? No. Then I'm going to auscultate it after inspection. So first I'm going to listen his right lower quadrant for the bowel sound. Then right upper quadrant. Then left upper quadrant. And then left lower quadrant. When did you have your last bowel movement?
This afternoon.
This afternoon?
Yeah.
Okay, and is that normal? Like usually how you
Yeah.
have it? Okay. Then I'm gonna palpate for any masses, any tenderness.
Okay.
Are you feeling any pain when you do this?
No.
Okay. Alright. That's good. Now I'm gonna move ahead and check his extremities, upper extremities, for any discoloration, any bruises, any abnormal marks, no. And then I'm gonna check his brachial pulse. They are both symmetrical and bilaterally symmetrical and equal. Let me check the radial pulse. Yeah, it's regular. And then I'm gonna check for any for capillary refill. It's good, and there is no sign of any numbness, no tingling, no bluish, no cyanosis, no any signs of jaundice. Then at the same time I'm gonna check for turgor of his skin, for any dehydration. Okay, it's good. Then after that if he is in catheter, then I'm gonna care for catheter, and then as well as perineal care. Then I'm gonna go ahead and move towards the lower extremities and inspect for any bruises, any lesions at this time. So it's normal. And then I'm gonna palpate the popliteal. I'm gonna palpate the popliteal pulse here. And femoral pulse. and then dorsalis pedis pulse. They are regular bilaterally and then symmetrical. Then I'm gonna check for posterior tibial. Alrighty, that's good. And I'm also gonna check for any edema. No sign of edema. Then I'm gonna check for his muscle strength. Can you push on my hands and up? Okay. And then push down, up. Alright. Alright, Mr. Sister, I'm done with your health assessment from head to toe. Let me wash my hands first, okay? So I'm gonna wash my hands. Hand hygiene. Then I'm gonna place my patient in comfortable position. You can see, you wanna sit like this?
Yeah.
Alright. Then I'm gonna put the bed at the lowest position, side rails up, and I'm gonna give him the cold light within his reach. After that, I'm gonna wash my hands again and then document my every findings. If I find any abnormal finding, then I'm gonna let him know and I'm document my findings. And yeah, I think so. This much. Thank you so much, Mrs.